you like place the seniors to find their best home,
Hmm.
place the best senior care options. So they have financial. So the decisions they took like depend on the
Meaning that they have money.
yes.
Okay.
Sometimes they have money, sometimes maybe they have issues or challenges with the money,
Mhm.
and doctor recommend them something. And so how you manage all these situations together, like what doctor recommendations, but they have less fund, and that's a challenge, and how you combine all things together and how you find the best home for them.
Well, doctor recommendations, they're always important, and I always take them in consideration. They're a certified, qualified medical professional. Um, and but then we talk about the details of their particular situation. Every individual elderly that needs care or help, they get to that point. It seems that it's different for everybody. Definitely, there is not like one size fits all type of situation where there is a standard, there is um, um, a universal way to go about it. So a doctor visit sometime is 10 minutes or 5 minutes or 15 minutes, uh, where there is only so much information that can be shared within that timeline. My conversations with the families or the individuals, sometimes they're an hour, sometimes they're an hour and a half. So there is a lot more volume of information that is shared in our conversation versus just a doctor's visit. So I think that would allow me to reevaluate what the doctor said or what the doctor recommended, take that in consideration, but also make my own decisions on recommending and suggesting what would be the direction to take. Sometimes it matches with what the doctor recommends, sometimes it does not. And the only difference, I think, uh, the only reason for me having a different recommendation than the doctor initially had is just because I gathered more information than the doctor did. And I think I'm more and better informed about the overall situation.
Okay, and it can also link with the financial things in the mind, like because of the financial situation, that direction is changed, like the with the doctor that recommend, or it is just like you experience and you find out something different, what doctor find it out.
Well, going back to what people generally know about the senior living and what they don't know. And many people, they just don't know what they don't know. And what happens is, the doctor makes a recommendation. The daughter or the senior, they think that, they have Medicare or they have another primary insurance. The doctor visit is covered by that. And the doctor recommends, well, you should go into an assisted living. Many times people, they assume that an assisted living would be covered by Medicare as well, you know. So they say, oh, okay, we're going to assisted livings. We could be going to assisted living and the insurance would cover. Well, then they meet with me and they talk with me and they find out that the healthcare insurance doesn't have anything to do with senior living. And they're completely two separate things. And then going into an assisted living, um, it would be an out-of-pocket expense. It would be what we call private pay. And then when they find that out, they say, well, how much does it cost? Well, it depends on the location, depending of the company, depending of the care needs, your mom or dad has. And it could be, $4,500 rent for a studio or a one bedroom, and then you can add $1,000 care on top of the rent. So that would be 5,500. It's like, okay, We can pay 5,500, but we're, at some time in 2 years, we're going to be running out of money, or in 6 months or a year. And then we say, okay, the conversation then turns a turn and is, well, if there is a possibility that you'd be running out of money anytime in the near future or the future, then, and you want to go in assisted living, that's going to dramatically narrow down the options, because you don't want to move into an assisted living and then when you run out of money down the road, they'll ask you to move out. So it has to be an assisted living that is contracted with Medicaid, and they have a program that is called the spend down program. That means that the facility would say, if you pay us privately out of pocket for a certain period of time, and generally it is 2 years, or in most cases it's 3 years. And if you pay us privately out of pocket for 2 or 3 years, anytime after that, if you run out of money, you go on Medicaid benefits, you're welcome to stay. We're not going to ask you to move out. So when it comes down to a spend down program and assisted living's contracted with Medicaid, then everything narrows down to 3 options, 4 options maximum within the greater Seattle area.